Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. Joining me today, I have Michelle Murphy, Director of Marketing and Public Relations, and Tom Carrico, Vice President of Operations with Hardin Memorial Health. And today we're going to be discussing the advancements and how you can become engaged in your medical care, especially through technology. So there's a lot happening. And Tom, tell us a little bit about what's happening with how patients can become more engaged with their personal health care through technology.
Well, I think probably the biggest advent that's occurred in the last 3 to 5 years has been the implementation of what's known as a patient portal. Personal health records are the general term that's used for this technology. Patient portals are the access point by which patients can actually see clinical information, things such as radiology reports, laboratory results, pathology reports, which helps them understand what is actually occurring. And when they see things that maybe look suspicious, a high level or a low level on a laboratory result, for example, it gives them the ability to ask their clinician, their provider, what's going on with this. So it really is a tool that has become, I think, one of the drivers of patient engagement here, which is obviously a much bigger, broader conversation in the Affordable Care Act and something that we're trying to do from a healthcare industry perspective as well.
Well, in the last 5 years, there's really been an explosion in technology, and it's given our viewers and ourselves the opportunity to really find out personal health information, obviously through this portal that we're talking about. We can also download apps. We're able to track how healthy we are through our lifestyle, through Fitbits and different things that we're doing and taking challenges and health risk assessments. Tell us what Hardin Memorial Health has really done to be a part of this explosion of technology.
Well, I think it goes back several years because we've invested in electronic health record technology and those technologies that improve patient care and patient care outcomes. And through that natural course of investments and adoption of those technologies, really what's happened is that's the back end. That's all the information going into those systems, you know, from a clinical, administrative, and financial perspective, all coming together to serve and provide that appropriate information that now the patient can see and understand on the front end. This is relevant to my health, and this is something that I need to be onerous of, because if I am and I understand what is occurring with me clinically, then I can be better prepared to ask the right questions of my provider, you know, in terms of, you know, what is occurring here. So I think we've had a major investment in technology that's now allowed us to put information in front of the patient that really is driving them to become more engaged in their health.
I think you made some great points, because I know we've stressed, especially in previous episodes of Health in the Heartland, really partnering with your healthcare provider and how important it is to be a wise healthcare consumer. So Michelle, tell us a little bit about what the benefits are as far as becoming maybe engaged in your personal health.
We've talked for years about how important it is to know your numbers. We often preach that whenever we go out to any of our health forums or fairs. The thing with the patient portal is we're able to actually trend and track all of that information. So you may be a fairly healthy person seeing your blood pressure within normal ranges, but when you take a closer look, you might see that it's been slightly elevated over a period of time. At that point, you can go into your doctor and say, you know, I've been watching my blood pressure, I've been watching my glucose. You know, is there maybe something going on? That allows us to trend all that information and get a visual impact of what's going on. I also think, coming back, you know, from a parental standpoint, you know, watching your children or helping an aging parent, being able to have all of this information in one place is an extremely powerful tool for any of our chief medical officers of the family.
Well, you know, we've talked too about, in the past there was a chart, you know, kind of that chart that would be all the information between the physician or the healthcare provider and the patient. Now everything has gone to what we call an electronic medical record. Tom, tell us a little bit more about how secure the site actually is.
So they use industry standards, actually what they call encryption standards, to ensure that that data is protected at all times. In essence, because this is a web-based solution, the data actually resides at a location off-site. It's not even on premise at the hospital, but we do maintain that security through those encryption technologies. And the reality is any and all data that lives out in the internet is suspect of potential breach, because there are hackers out there that can access that information if they really choose to try to break through. But we have invested in a technology that really makes that very difficult to occur. So in terms of what we can do to protect that data, we've taken every precaution, even to the extent that the questions that we ask patients when they come into the hospital or they come in seeking services and we provide them information on the patient portal, we ask questions to ensure that it is the appropriate identity of the person that is going to get access to this information. We take those precautionary steps.
Years ago, if you were going to a new healthcare provider, or actually your provider that you've been going to maybe even for years, sometimes you would have to literally pick up a chart, go to medical records, get that information, and literally hand carry that over. So those days are starting to fade away just a little bit because of the access, and again, really stressing that partnership with your healthcare provider, correct?
Absolutely. I think what we've probably witnessed in the last really 2 to 3 years is I think a change of a mentality that, one, as the healthcare consumer, I own this information. And so where hospitals and physician offices have felt that ownership to the record, for the most part because they felt the security burden of that information. Now that trend has really changed, and the consumer-driven healthcare approach is really becoming, I think, a huge culture shift that we're seeing in the industry. And it's the appropriate one, because at the end of the day, I own that information, and it's my information, as Michelle indicated. It's my information to take action on that and to seek the appropriate answers and to ensure that I am looking out for my own health and wellness.
Absolutely. We're getting back to that personal responsibility for your own health care actions that you make, and it's all about choice and what you're going to do with it, and empowering the viewers really to learn a little bit more about what they can do and how they can ask questions and taking care of themselves. Now, Michelle, you come to the hospital, you go to your physician, you're interested in maybe being a part of being on the portal.
Sure.
What do you do?
It's a really easy process. Anytime you come to Hardin Memorial Hospital and you register for any lab test, surgery, inpatient stay, whatever it might be, within our registration process is when we actually do the relationship, as Tom had talked earlier, those specific questions that only patients would know about themselves. We call that validating the information for the patient portal. Upon that, a patient gives us an email address. We ask some very simple questions that match up within their profile, and then an invitation is sent via email. Then once they're back home and they're settled in, they can get that information, click on a URL that is within that email, and then you go through a couple other quick, easy steps, and then you're actually inside the portal. And anything that you had done at any of the Hardin Memorial Hospital or Health locations back to 2012 is actually, those results are loaded in your portal. So I think from patients that I've personally helped sign up, it's very gratifying to go through that process and then go back and look at your health information that's back in there from previous tests or procedures that you might have had in previous years.
So they're able to look at trends back through 2012, correct?
Yes, November 2012.
Now, you talked about too going home.
Yes.
And getting on the computer, but this is also mobile, is it not? So tell us a little bit more about not just having to be on your computer because it is a portal.
Well, the demand is there. In this day and age, we do everything via our phones, or at least we attempt to do everything via our phones. So the technology has to be available to the phone. We have taken additional precautionary steps to ensure that security would still be in place. But the application that we use is available. You can actually go to a phone and you can log in securely to that portal and access the information as you would if you were on a PC or you were on a laptop or you were on a tablet.
So it's on the go.
It is. It's on the go.
Tom, we've talked about it really being accessible, and it's actually on the go. It's mobile, and
It is.
can't stress enough the importance of the secure website, and actually web portal, I should use that term, and the fact that they can log in and they're using their personal password to get on.
Correct, Karen, and you're right. You cannot overstress the importance of maintaining confidentiality of that information, because you are essentially allowing that information to be available to anyone should you allow that information to be shared, that being your ID and or password combination. So maintaining confidentiality is important, and I would liken it to the banking industry. Are you going to give up your PIN number, your ATM and PIN number, to somebody else? For most, healthcare information is that secure, and or the need is that great to have security with health information. So I think that because there is other relevant identifying information in the healthcare information that's provided in the portal, we obviously want to stress the confidentiality and maintaining that security on your person at all times.
We've been talking about security and actually building that relationship and taking personal responsibility for your health, especially with the electronic medical record. Does the patient, I guess I should say, does the patient request that it's okay for their healthcare provider to see that information, Michelle?
Yes, actually they do, and that's the wonderful thing about a patient portal. The patient is actually in control of everything. They decide who gets their information and what information that they get. And we've been using that word relationship all morning long, and the reason why that we're using the relationship is that the patient has to decide and give access, and we do coin that as a relationship. What happens is a notice will go out to a practice. The practice then will verify, just as we did at the hospital, that this patient truly is one of our patients. They use some very specific security measures to do that. And once they are sure that that patient is the patient that they're currently seeing, that relationship is granted. And so that allows for that information to transfer from the provider to the patient's portal, from the patient's portal back to the provider.
So this is really opening up a great line of communication between the healthcare provider and the patient to make sure that they're getting not only the access to their medical records, but the access to care that they need appropriately and promptly, correct?
Yes. There's a correlation between patient engagement and the provider's provision of care, and I think what I have witnessed in recent days is a conversation with providers who specifically say, I was really not for the patient portal in the beginning. I really was worried about relinquishing and or giving out information that patients may react to because they don't understand it quite fully. But now I really appreciate that information being given to the patient because that patient is able to prompt me as an extremely busy physician. So, as an extremely busy provider, who oversees, in some cases, thousands of patients, a slightly high elevation in a specific laboratory result, for example, or a lower result may not warrant some critical alert to that provider. However, that patient can ask the provider, hey, what's going on with this? Is there something that I need to be doing? It's a much better conversation now between the patient and the provider. So I think that's another cultural shift that we're seeing is as we're educating our patients and they are getting online continuously to see what diseases, what chronic conditions and or ailments they may have and what that really means, they're now going in and asking the physician the right questions. And armed with the information that we provide in the patient portal, it gives them that ability to ask the right questions and to appropriately engage in their own health care. And the providers are saying, we do appreciate that. So it's a good shift of events.
And I heard you say conversation and also engagement. We are still, though, at a point where it's not, and I'm thinking of all our high-tech viewers out there that might be emailing and doing different things. These are still, you look at the information and then have that verbal conversation via a phone or actually a visit, correct?
That is correct, but you can also message your provider for those physicians that we actually have signed up for that particular technology. the physician can either message the patient or the patient can message the provider. Now, in most cases, the patient is messaging into that physician's office. And there are many messages. There are just questions that in some cases the nurse in that office can answer, but there are some that may be forwarded on to the physician, and he or she can then answer those questions, and then a response go back to that patient securely, again, within the patient portal, and then that question be answered without a phone call or anything else. So that is another component of the technology that we're working to adopt across our continuum of care, because it will hopefully lessen the amount of phone calls and lessen the time that the offices spend administratively answering those questions for patients.
As you're talking, I'm literally sitting here thinking that healthcare really is in our fingers or in our hands, because we're able to access it via our phone, or whether we're on the texting or getting onto
just want
yes,
to text.
absolutely, yeah, or logging into this portal. Now, Michelle, I know we have a website, www.hmh.net. Tell our viewers how actually, if they logged into that they would have access to the web portal.
Yeah, we've made it very intentional to make it very easy. We understand that a lot of people aren't computer savvy, or they may not, come and visit the hospital website every single day. So at the top of hmh.net, there's a little tab that says My HMH Record, and that's the way that you would access it. So it's no special URL to remember, no special place. Just if you go to hmh.net, you know that you can click on that top tab up in the upper right corner and always have access to your patient portal. There's a lot of other tools and tips and things that we have out on our website as well. We went through about a year ago, as we've talked about all the mobile access and having tablets, and redesigned our website so that it was what we call responsive. It knows based on when you come to our website, are you on a mobile phone, are you on a tablet, or are you on a desktop computer? And based on the device that you're using, it changes its display. So it's very mobile friendly. One other aspect is that we have an entire section called Health Link, and that's really our health content. And we've got 90,000 health articles, videos, podcasts, quizzes, wizards, all types of educational information that's a trustworthy source that patients can go to. So if they are trending information within their portal about blood pressure or glucose and they need a little bit more information, they know that they can go to HealthLink, look up any of those different disease processes, and find out more information about it.
Sounds great. Well, Tom, some of our viewers actually may have some hesitation, as great as it sounds, to share that information with their healthcare provider, and of course then empower themselves to take responsibility for their health. What would be some of the positive notes that you might have in having those individuals come over to the other side as far as the technology is concerned?
Well, I think first and foremost, what consumers need to realize is that the patient portal is not only secure, but it is not allowable in the healthcare industry to share that information outside of a very specific need to know. And really what that means, many have probably heard of the HIPAA guidelines, for both privacy and security. But those are very strenuous laws that are in place that govern data, and it ensures that patients' information is not going to be sold, for example, to a third party. If I am a pre-diabetic, for example, that my information is not going to be then sent on to some third party to be marketed against. So those practices are unlawful, actually. So we do not allow that. Now, what we do in general and have for many years is we look at the data that we have in our systems and we say, okay, there are, based on certain factors, we're seeing a trend in these types of diseases, and so how do we better serve that population because we're seeing trends in certain diseases? That really has nothing to do with the patient portal. It really is a separate proactive process for healthcare organizations to better manage the populations that they serve. And since we serve such a large, diverse population, 10 counties, et cetera, that is actually a benefit. But really, that is completely separate from the patient portal, which is secure and only gives access to those providers that are part of that patient's care record and or to the patients themselves.
So we're hearing the terms, population health, and that's really looking at across the lifespan of our groups that we have in our 10-county area, or actually nationally. I mean, that's a national term that we're looking at there too, as far as population health. But how we can better serve those individuals, give them access to quality care, and making sure that they know how to take care of themselves a little bit better too.
Yeah, and I think that's part of the cultural shift that I was describing earlier is, we are trying to go from a population of acute illness and episodic treatment of care to one of truly managing the health of the populations that our health systems serve. And so for Hardin Memorial Health, our focus has to be on, in the very near future, and is to some degree now, how do we not only treat these patients outside of the hospital, how do we keep them out of the hospital? And so by providing things like a patient portal, which gives that patient information that they need to make decisions for themselves, we're also seeing care that's being provided outside of the home. For example, we actually have a program in place where we're able to monitor patients in their home, physiologic monitoring such as blood pressure, heart rate, oxygen saturation levels, and we're able to do that in the home setting and be able to better predict whether that patient is at risk for a readmission into the hospital. Where I want to see us move the patient portal technology is to be able to obtain that same information and be able to have that information available to the patient within the patient portal. So home telemonitoring is one point of access that is in our very near future to marry those two. We also, as you mentioned earlier, Karen, personal wearable devices, the Fitbits, things of that nature that are truly monitoring biometric feedback from the person, being able to take that data and have it as part of the patient portal so that you're getting a comprehensive view of not only the test results that you've had at the hospital or in one of our outpatient settings, but also here's overall the picture of your health. And that's really where we're trying to go with these technologies, so that it is broad.
And I think, as you mentioned, looking at the person, sometimes we just see that snapshot of, this is your lab results here, but we're not getting the whole picture, and this is really
Correct.
enabling the patient, the healthcare provider, everyone that's touching that individual to have them have a healthier well-being and
Correct.
just a better quality of life in the long run. We've talked about some terms there too, kind of an acute episode, which means usually that's a one-shot deal. You're in and out, maybe the broken arm, those types of things that might happen, and unfortunately. But we have a lot of patients that have some chronic health issues. Now, Michelle, if I've had maybe some things in the past, how would I have that be part of my medical record electronically?
Well, if you had any type of complex disease process, diabetes, congestive heart failure, anything along those lines, all of the testing and results that your doctor may have done to help diagnose and treat you would reside there in the portal. So that's especially important whenever we're trying to keep people from getting any worse and start to improve their health, because that gives us data sets to actually mark our improvement or look to see what other things that we can do.
Well, we appreciate both of you being here with us today and sharing this important information, because it just sounds like it's exploding out there with all the possibilities of having us improve the quality of health for our local individuals and also nationally too, as we look at all the trends that are happening with technology and with healthcare in general. For further information, we invite you to go to www.hmh.net. You can click on My Record, explore that. The next time you see your healthcare provider or come into Hardin Memorial Health, please ask about the patient portal. Again, we thank you for joining us this episode and hope you tune in next month for another important edition of Health in the Heartland.